Hear the words heart disease, the last thing that comes to mind is children. Coronary heart disease remains the single greatest killer of Australian adults, but congenital heart disease is a different condition, and its effect on an infant is truly heartbreaking. 1 in every 100 kids are struck with childhood heart disease. It's the greatest killer of Australian children under 5 and takes twice as many lives as childhood cancers. Well, HeartKids Australia is currently our only organisation dedicated to this cause, and CEO Neil McWannell recently spoke with us.
Neil McWannell, thanks very much for your time. Now, heart disease is something that we would normally associate with older Australians, so talk us through childhood heart disease, because we're talking congenital heart disease, not coronary heart disease.
That's right, and when most people do think of heart disease, they think of adults with coronary heart disease who have smoked or drunk or done something self-inflicted in some way to have impacted on that, whereas we're talking about congenital heart disease. These children, just through a cruel hand of fate, were born with heart disease. It's been identified that this occurs or develops in the early weeks of the pregnancy, where the heart twists and turns, and for a reason that's unknown, malformations occur in a significant number of children.
Are we talking that it will strike children randomly?
Yes, the parents will often, who have a child with heart disease, will often blame themselves, as we saw recently with John Travolta when he lost his son Jet. He was born with the heart condition Kawasaki disease, and I recall hearing that he was blaming himself and possibly carpet cleaning agents that may have caused that. And we find that many of the parents who do have children will often try and look at, did they drink or smoke or do something that may have impacted on that child. But our research shows that it's just a cruel hand of fate, that just nature, for whatever reason, produces these malformations. Some of the research that HeartKids is funding is looking at some of these causes. One of the really interesting ones is the role micronutrients may play in this, in the same way that spina bifida has been, they've discovered that a micronutrient has a major role in that, in the cause of that disease.
Are there any known risk factors at all, though?
Not really. If a parent already has a heart kid, their chance of having another one increases slightly from 1 in 100 to 4 in 100. But for many families, they have all their other children are perfectly healthy, and for some reason along comes a child with this heart condition. Generally
speaking, how likely is it that a child born with a heart condition will survive?
Well, just 20 years ago, many of these children would have died at birth. They were the blue babies that we heard about that just died at birth. Now, for the first time in our history, we have more children over the age of 20 who have survived heart disease or who have childhood heart disease than those under 20. So there's lots being done, major advancements in surgery, in medications and what have you, but it still is the greatest killer of children under the age of 5 in our country.
Because a child that small would have a heart that is still developing, what sort of impact might that have on treatment and the chance of a successful recovery?
Well, yes, I often use it as an example that the size of a newborn baby's heart is just that of a walnut when it's born, so incredibly small. And many of these children require complex open heart surgery at that time. And you can appreciate a heart that small when it develops into as the child grows. If there's been valve replacements or other modifications done, then the heart will need further operations to cope with that.
I would imagine it's quite distressing to see these families with children under 5 having heart surgery through, as you said, just a cruel twist of fate.
It's one of the most traumatic things I've experienced going into a children's intensive care unit, where you'll be amazed that almost half the beds in every children's intensive care unit in the country are filled with heart kids. Almost half the beds. And to see these little children with their chests cut open and wires and tubes and other life-saving devices attached to them really brings you down to earth and realises how fortunate we are to live the lives we are and to have happy and healthy children. So that inspires us to try and do more to help these families and to ensure that in future that less children are born with heart disease and that mortality rates decrease.
Just generally speaking, if a child is born with a heart condition and survives, can they go on to live a relatively normal and lengthy life?
Some of them, the repair is complete and the child will live a happy and healthy life. For many others, there's ongoing surgery required, valve replacement. One of the particular operations, the Fontan procedure, I was talking to one of the leading surgeons yesterday, and he said that this whole group of children who they've been able to save will get through to their 20s and then put a significant demand on health services, because many of those will require heart transplants. And that in itself, the heart transplants for younger children, is a problematic operation in itself. Not only are the hearts very hard to find and source, but the immune suppressant and anti-rejection drugs that a child has to take, because their immune systems aren't developed, are incredibly powerful, that they'll end up damaging other major organs. It's also a palliative operation in that a replacement heart will only last between 10 and 15 years. So whilst we can save these children, they are placing a huge demand on our health services. And HeartKids Australia does not receive a cent from the government. We rely on support from corporates and from individual donors to allow us to do our work, where we support families. Many families are left totally destitute through no fault of their own when they have a heart kid.
So what should we be doing? What would you like to see happen?
Well, there's a lot of support needed to fund further research in this. There's very little research being funded around the country. HeartKids, since we started our operations, we're now funding 4 research projects. There are many, many other researchers out there wanting to do work in this area. We need to be assisting them. We try and, at HeartKids, we try and assist the families. We employ family support coordinators in each of the major hospitals. Again, those all need funding. The families themselves need assistance with travel and accommodation. So all those areas, as I said, we receive no funding and rely on the generosity of individuals to support us in our work.
Well, you've brought in some photos of what you call your heart kids, children who have survived a heart condition. Tell us a bit about perhaps one of these children.
One of the beautiful girls is little Michaela Tyrrell from Melbourne, and that hospital in particular has been severely impacted by a lack of intensive care beds and trained nurses to be able to deal with these patients. And her condition is a life-threatening one that needs immediate intervention and surgery to save her life. And yet, through these lack of resources, her surgery was cancelled 6 times. The Adelaide family I spoke of earlier, their surgery was cancelled 4 times. These are our young Australians' lives that we're dealing with here. So at HeartKids, we're trying to influence and advocate to the government the need for better resources here. At HeartKids, we've also, in order to address this, we're just embarking on commissioning an independent white paper looking at the needs of congenital heart disease. It'll involve all the cardiologists, surgeons, hospitals and the parents of HeartKids to identify what exactly are the needs, so that we can present, as I say, an independent paper on behalf of everyone to the government to show what the needs are and hopefully present a model of best care.
We're doing great work. Neil McWannell, thanks very much for your time.
Thanks, Natalie.